always better at recording in progress. God, you missed all that. We just started recording.
Could you repeat what you just said, please?
It's actually better to start recording Joey and Trisha anyway. So without further ado, Ace Team Supervisor Joey Klotz, take it away, buddy. Tell them about the night of trial.
Thanks, Mike. Well, as with every story of favor, I guess I can't start without telling you a little bit about my story. So unlike most of the people that we do see on the ACE team, I was brought up with about everything a person could ask for. Loving parents, affluent household, ample opportunities at anything I really wanted or needed to do in my life. And it did not stop me from developing an addiction problem and still going through some of the trials and tribulations that come with it. And one of those towards the end of my active addiction was a stay in a hospital where I had gotten an infection in my leg from using needles. And, I had to check myself into the emergency department for some help. And I don't remember much about that night or those 2 weeks in general, but I do remember the doctor looking at me and telling me that he was wasting his time helping me because there was other people in that emergency department that were in need of his help. And I was there because I was a junkie and because I was doing these things to myself. And at the time, I can't tell you how much that hurt, which is why I remember it to this day, but also I believed every word he said. So the opportunity I have today to work on this ACE team, to disprove everything that man told me, and to help other individuals who end up in similar situations has been a godsend, to say the least. The ACE team in general is responsible for 5 local emergency departments that we respond to. We work 24 hours on call shifts and we work 7 days a week. Like Mike said, we respond to people who usually have lower income, less resources, and who are in need of extra care and extra attention. A couple of cases that come to mind that I'd like to discuss with you guys is a woman that I've been working with for quite some time who lost custody of her 4 children as a result to her alcohol disorder. She was in Greer Memorial and we got a call from her and she was broken. She had lost it. She had given up. Suicidal ideations were involved, and excuse me, and she was at her wit's end. Excuse me, and she had no advocates. She had no family left. She had no friends. She had nowhere to turn to. And by simply showing up that day, I could tell it meant something significant to her. And I started to work with her. I started to learn more about her and what was going on, and found out that she was a very hardworking, good person who could not kick her alcohol problem. She drank despite losing custody of her kids, and as most people can relate to, she actually started drinking more, after the judge decided that she was no longer able to see them anymore. And after working with her for several months and getting her to a place where she felt confident, she invited me to go to one of her supervised visits with her children, which I thought was absolutely the coolest thing that I've ever done. It was a chance to validate kind of some of the stuff that we do on the ACE team, because we can go above and beyond for people. We can go that extra mile to meet people where they are at. And without the donations from the people that are in this chat and the other people around the community and outside the community that donate to favor, that the ACE team couldn't exist. We couldn't do what we do. We wouldn't have the manpower to be able to pick people up from the hospital and take them to an MAT clinic, or take them to a loved one's house to spend time, or just take them out for a cup of coffee and just show them that somebody cares about them, even if all of the people in their life have stopped caring, or at least stopped trusting. So it's one of the greatest things that I've ever been a part of in my life. And another case that comes to mind is the case of a young woman that I was working with who had witnessed her boyfriend at the time overdose. They would buy pain pills together, and they bought a bad batch. And unfortunately, he decided to use before she did. And she witnessed him dying in front of her eyes before she ingested the medication. As you can imagine, this was hugely traumatic for her. And she was struggling to find a reason to keep going. And I remember getting called in to see her, and I had never really been in as an emotional first interaction as this one was, even though some of these interactions are very emotional. The pain in her eyes from the loss that she had just experienced, not just experienced because she lost him, but literally experienced because she watched it happen, was overwhelming. And at the time, you wonder, how could you possibly help somebody who is just seeing such an awful thing, and how do you help them now try to figure out a reason that they should, get back on track? And at first she didn't. She started to get worse and worse, and she went from taking pills like they were doing that night to shooting pills and to shooting heroin and basically anything that she could get her hands on. She actually had overdosed herself in the future, and I got another call from a separate hospital, and I saw her again, but this time she wasn't there because she didn't feel right. She was there because they had to Narcan her and bring her back to life, and she technically had lost her life for a few minutes. And in working with her, it's just, you see this hope in people. I can relate to my own story. I view it as a regular story, I guess. But when you see it happen with other people, it just seems inspirational in a way that you never look at yourself that way. But when you work with others and you see the progress that people make despite some of the obstacles that they have to overcome, it's unbelievable. And it really is so humbling in a way that I wouldn't trade what I do for anything in the world. And as I mentioned, what we do here at Favor in general, but specifically on the ACE team, is not something you see in other cities. This is a very unique program that the NIDA trial is trying to legitimize and to make it a worldwide national common thing to do. And Trisha Lawdahl, who I'm about to hand this over to, will talk a little bit more about the actual study and what's involved in that. But just from the perspective of the coaching that goes into it, it's not just beneficial to the people we help. It is absolutely beneficial to myself and to every other coach out there, because it serves a purpose. We're doing something of value that is unique, and that you can go home at night knowing that you've served the community and the world in just a much bigger meaning than I ever thought my life would have. It's more than paychecks. It's more than that. It's a life-fulfilling dream of mine to be able to help people the way that people bent over backwards to help me when I was in need. And as I mentioned, the difference is a lot of these people would never get this help. I was always going to have help. Somebody was always going to be willing to help me, because people were always willing to pay for somebody to help me. And it was up to me to kind of step into that role. But for a lot of these people, nobody cares. Nobody knows. They're not seen. They're not heard. Some of them don't have housing. Some of them don't have food. And without a team like the ACE team, without a trial like the NIDA trial to legitimize what we do, there are so many people out there who just go without help. And these people deserve help, and they need help. And thanks to the donations of everybody on this Zoom call, like I mentioned, and all the other donors, we're able to help these people in an adequate way. And it's a meaningful thing that it's just incredible to be a part of. And speaking of Trisha, I absolutely love working for Trisha. She's the best, and she is my favorite person here at Favor. So I'll let her kind of finish this up and tell you guys a little bit about the NIDA trial. Thank you for letting me share.
Thank you for that gracious introduction, Joey. Mike, did you want to say anything before I go ahead?
No, I'll fill in the blanks, but you
Okay.
do a great job. You first.
Okay. All right. And, back at you, Joey. He is such a wonderful person to work with, such a great supervisor. And I have to say just about our team in general that we are very supportive of one another. And that really is a requirement of this job because it's very emotionally intensive at times. It can be physically intensive at times. We've moved a lot of people from different places. But we really support one another emotionally, mentally, physically, cover for one another. And it's just been a wonderful team to work with. So the NIDA study is the National Institute of Drug Addiction that has sponsored this study. And it was started about a year ago with some experts from MUSC and another expert from San Francisco and the public health department there, who has worked with HIV patients for decades. And all of these people on the team have been we've been developing a manual to write down what ACE coaches do, because this is a pretty new animal to the addiction field. It's been done in the mental health field before. And so we've adapted a lot of those principles of going out into the community to meet people. Whoop, what happened? Are you there?
You're good. We didn't lose you.
I'm here. We're here.
I lost you. Okay, I'm back. So, and ACE stands for Assertive Community Engagement. So many of these people, as Joey described, cannot come into the Favor office in Greenville. They don't have transportation. They don't have money for an Uber or a bus pass. And so where we meet most of these people are in the emergency departments, as he described, who have different needs. They've gone into the emergency department for some substance use related problem. Maybe they're withdrawing from alcohol. Maybe they've overdosed on methamphetamine or opioids. And then we see them and find out what their needs are. Again, multifaceted, could be housing is the most immediate need. And so the study is trying to write down step by step things about motivational interviewing that we use with people to help them to gain some self-esteem and some self-efficacy so that they realize they are the experts on themselves. And we guide them rather than direct them. As maybe a physician would. We get their input on how they would like best to try and support them in those efforts. And so the study is going to follow people over a 6-month period of time. We're hoping to start perhaps sometime this October. We will be doing some trainings virtually and in person in Charleston. We have 3 sites. Greenville, Favor Greenville is one of them. We will have 3 coaches working with patients at each site, along with a multitude of research staff and physicians that will help these patients. The other 2 sites are Youngstown, Ohio, and Everett, Washington. This study will follow non-fatal opioid overdoses only. We will randomize these patients into either the intervention side, where they will get treatment from ACE coaches, or the treatment as usual, where they will receive services that they would normally receive in the emergency department. And what we're going to do is study and see, do the ACE coaches make a difference for these people when we're following them long term? And many of these patients we literally have followed for years. And we don't stop at any point. We may have to in the future. But at this point, we just hang in there with them, because their road is not a straight line. It's very much a zigzag. It's very up and down. Things happen, things get better, things get worse. And these are people that seem to need a long-term coach to support them and go along, with them on their journey. And a lot of the things, as Joey mentioned, housing, transportation, mental health issues, getting medications. I've got a guy in ANMED right now who has severe mental illness, is trying not to use. He's in the Salvation Army there. He has 1 mental health medication pill left, and he's freaking out because he has no refills. So we are going to go to him at the Salvation Army, get him to the Anderson ED, and see if they can write a prescription while the Salvation Army and we help him get mental health services. So this is the big picture of people. And in doing that, we hope to keep him away from his substance use disorder and try to get him some degree of independence. And even if he lives at the Salvation Army for 90 days, that'll give us some time to help him find some housing. But it's a big challenge. Mental health help in the state of South Carolina is very lacking. So that's another big reason for us to be able to walk alongside someone and help them with those mental health issues, sometimes on a moment-to-moment issue. So with the study, we'll follow them for 6 months. They will be contacted by the research staff as far as how they're doing, check-ins at 3 months, 6 months, and then a follow-up at 7 months to see how they're doing, to measure the differences that we're making. There's all kinds of quality assurances in there for fidelity to make sure that we're studying what we say we're studying. Lots of recording that will happen around what the patients are doing, how they're doing it, how we are doing as far as helping that individual. And I think it's going to be a fabulous study that has not been done yet. And it's really one of the first studies. So we will learn a lot from this and be able to move forward and do more studies. And really to document, is there value in this? Are patients being helped in a valuable way? And is it making a difference to readmissions to the ED? To their quality of life, to their health, mental health and physical health, all kinds of things that we can measure. So that's pretty much it in a nutshell as far as the NIDIS study. We're real excited to be part of that. And it's been fascinating for me to be part of developing this study. I've never had the opportunity to do that before. So it's been very educational. So thank you for your time and for being here today.
Can I just add one thing to what Tricia said? And the study compares everything that she just discussed with what we're going to do for the participants who end up in the program. And they compare it to the traditional means that are now given out by the hospital, which is usually a pamphlet of numbers and local detoxes, maybe some treatment centers of here's who you call. And it's oftentimes when somebody has no home, no phone, no insurance, the resources just don't fit them. And that's why I think what we're doing is so important.
Exactly. That's why this is so cutting edge, because it really is. It isn't being done in a lot of places and has never been done at a high level in respect to people that suffer with these kind of issues and go to the hospital. So going to open it up for some Q&A, and Tricia, Joey, awesome job. I wanted to say this real quick too before we turn it over to y'all for questions or comments. You know, as a nonprofit with a mission, our shareholders aren't people that own stock or individuals that buy into our business as partners, right? It's the people that support us through the donations they make. It's the communities within which we serve, and it's the participants that we're out there trying to ensure have the best chance at finding recovery. Those are the people that we want to answer to. And these little sessions like this give us a chance to really showcase for y'all how hard we are at work on executing our mission and the really cool things that we're doing to make sure that we execute at a high level, and also introduce you to the people that make it happen one day at a time, because the people are our greatest resource. And Joey and Tricia are like second to none in that regard. So I really do appreciate coming out and listening to us and like getting to meet them. And I hope you do appreciate how much they're doing out there for the communities we're serving, the participants we're out to help, that other places just aren't doing. That really does set favor apart.
And one other thing, Mike, just to remind you again, that ACE stands for Assertive Community Engagement. And we were chosen by MUSC to be the consult for developing the manual on ACE because we do it so well. The word has gotten out that Favor Greenville is an expert in this field. And so what a great opportunity for us to be sought out to develop how we do this step by step. And I mean, literally word by word. These people are sticklers for detail. So that's really exciting to me.
Does anybody want to ask Trisha or Joey a question or share a comment? We've got some time to hear from y'all that joined us today.
So I guess all I would say, it's really not a question, just a comment, and that, you know, I really do value all that you're doing. And it was good to learn more about how you're doing it and the way you're proceeding. I think you really have set yourself apart from others I know, like myself, who have, you know, worked through having addiction in one of their children, and knowing that that takes time. And I listened to Joey talk, and I think maybe not as affluent, but I think my son would say the same things. You know, I had a good family, good people, a lot of reasons not to choose to become addicted. But clearly, you know, it's not necessarily a choice. It's something that just happens, and it's hard to stop that train, right? It's hard to do that. So I certainly appreciate all that you're doing, and I really was intrigued by the ACE, what that meant and what it's doing, and I applaud you for really leading the way and being the ones to write the manual, if you will, so that others can begin to do that as well. Thank you.
That was awesome, Pete Edens. I don't know your.
Peggy, it's Peggy.
Peggy.
Thank you.
Thank you for sharing that.
Yeah.
Well, I'm certainly busy enough to wrap this up if nobody else wants to share anything. If Trisha or Joey have something else to add, or Joni, if you've got something else planned, go ahead.
Anybody have another comment or question?
Joni, I've got a quick comment. Just to see where this will lead is we hope that this will actually be published in a medical journal, that the results will, as we have had a previous study that we did with Prisma a couple of years ago, has been published in the Alcohol and Addiction Journal, medical journal. So this is the significance of the results, so that, you know, the entire medical community can benefit from what we glean.
Great.
Okay. Well, I would like to thank you once again for joining us. And I do hope this has enlightened you and also helped you to see how you and the support that you give to Favor is making a tremendous difference in the lives of others that we serve. Thank you for joining us, and have a great afternoon.
Thank you, everybody. Take care.
Thank you.
Bye-bye. Thank you.
Thank you.
Thank you.
Thanks.
Joni, will you hit end record?
Yes, I will.
Yay.
Here. Thank
No,
you.
you need
That
to
was
record all the
great.
people leaving. Important.
We're still here, Mike.
Where's Trisha's background, man?
Yeah, and what about, I'm gonna get on Joey for saying that Trish is his favorite person. He told me I was his favorite person.
He told
Yeah.
me that too, Mary Harris.
Oh,
Cheating.
man, he's in trouble.
He's in big trouble.
That was great.
You know, I'm just going to say something real quick here. I wish there had been an ACE program when I was in the St. Francis ICU 8 years ago.
Oh,
I had delirium tremens. It was about my third day at the Carolina Center, and they took me to the St. Francis ICU. So when I went home, I didn't know what had happened. I didn't know what was going on. I was left on my own devices, and it did not turn out too pretty.
mm.
So that is a personal experience that I have had So that's why this ACE department is really kind of near and dear to me. I just think it can be a game changer for so many people. That's all I've got. Thank you.
Yes,
Daryl,
Daryl.
I agree with you. If it had been available to my family, 15 years ago, it would have been amazing. So I agree.
And that Zoom session we just had would have been amazing too, Daryl, if you would have shared that then. So
Yeah, we're still
Well,
recording.
my
Come
phone
on.
was ringing.
I'm
Hey, we
just,
still have Deanna and Peggy and Carol.
Yeah.
Well, my phone was ringing here right behind me at Favor.
Yes,
It was.
busy volunteering.
That's right. Yeah.
Thank you,
Thank
Joni.
y'all.
Joni, very good job setting this up.
Thank you, Mike. It's wonderful. Great job.
All right, appreciate everybody.